their irritability. And also self-esteem had improved dramatically amongst the population that I was treating. All of the improvements were statistically significant. So what about the drugs that we used? 5 of them were on atomoxetines. 4 of them started on atomoxetine for various reasons. 1 had to be transferred to atomoxetine. I'll explain why in a minute. Only 2 of them needed above BNF limits of Concerta, so they were on 144 milligrams. The remaining 34 were all well within BNF limits, and they were on a mixture of the Concerta, Equism and Medikinet XL. So again, you've got a chaotic drug misusing population, people that go out of their way to get drugs, and yet the majority of them I'm treating within BNF limits. That was the disaster. We had 1 patient who developed a psychosis. My one and only person ever that I've caused to develop a psychosis because of my prescribing. He's doing brilliantly. Yeah? We stopped his Concerta, the psychosis went away, we put him on atomoxetine, his ADHD's really, really well controlled, he's not misusing any substances, and at the moment he's in Mexico working. So an absolutely amazing outcome from somebody who was a seriously chaotic substance misuser. So, conclusions. ADHD is common in a substance misuse population. We know that treatment of ADHD in childhood reduces the risk of development of substance misuse. However, the presence of ADHD complicates treatment of substance misuse disorders by those reasons I've said before. The guidelines tell us you can't do it until you've treated the substance misuse. Also, the presence of substance misuse complicates ADHD treatment. However, treat the ADHD can result in really positive outcomes for substance misusers, as well as the obvious improvements in the ADHD symptoms. Thank you.
Thank you, Pete. That's excellent. Sorry, those of you who might be planning to leave a bit earlier, can I just ask you to fill out the evaluation forms? They're in the packs that you were given. So we just need those filled out for feedback for the speakers.
The last presentation was particularly good.
Any questions for Dr. Mason? I have one quick question. Medication, choice of medication, because the guidance warns us against stimulant use, and I mean obviously atomoxetine tends to be chosen for those patients. What's your thoughts on that?
I think the guidance is right. I think in your normal clinic you should be going for the safe, non-abusable option, which is atomoxetine. However, if you've got the luxury like I did in the drug service, where you can prescribe the Concerta to be picked up with the person's methadone with observed consumption, then it gets rid of that risk.
It's interesting that the substance misuse is a real barrier in all psychiatric diagnoses, or not diagnoses but treatment, and certainly in primary care it's one of our biggest problems, is getting patients with substance misuse who we know also have comorbid psychiatric problems seen in the psychiatric services. And I just wonder if your findings with ADHD would be mirrored if we looked at anxiety, depression, and all those other psychiatric conditions. And I wonder if we actually were able to get these people into treatment for their psychiatric conditions, whether their substance misuse would also improve.
My view on that, and it's particularly with the psychological therapies, is it's a very, very easy way not to see people. It's an excuse. Over in Wirral, our drug service is no more. It's it went out to tender, so it's with a charitable stroke private organisation now. we've developed a complex needs team, and they offer psychological therapies for people with complex needs. So they might have ADHD, they've got personality disorders, and a lot of them are substance users. And basically the therapists that we've got there have wised up to the fact that actually you need to change the way you do your therapy in people who are substance misusers, that you don't deprive them of the therapy. I mean, numbers are small, so we can't really say that, you know, we can't say there's statistically significant good outcomes, but anecdotally I know of some real successes.